Difference between acute otitis media and acute pharyngitis. Look at this picture, shows that otitis and acute pharyngitis, normal bacterial infections or viral infections. Detail going on. Acute otitis media is an infection or inflammation of the middle ear, commonly seen in children, characterized by ear pain, fever, sometimes fluid drainage. Acute pharyngitis. It is an inflammation or infection of pharynx, characterized by a sore throat, fever, and swollen lymph nodes, often caused by viral or bacterial pathogens. Difference between detail going on. One definition: acute otitis media, an infection or inflammation of the middle ear. Acute pharyngitis, inflammation or infection of pharynx or throat. Two primary locations: AOM, middle ear. Acute pharyngitis affect throat. Three common causes: AOM, typically caused by bacterial infections such as Streptococcus pneumoniae or Haemophilus influenza, and sometimes viral infections. Acute pharyngitis can be caused by viral infections, rhinovirus, coronavirus, or bacterial infections such as Streptococcus pyogenes. For age group, most affected: AOM, more common in infants and young children. Acute pharyngitis, common in all ages, but viral pharyngitis is especially frequent in children. 5 symptoms: AOM, ear pain, fever, hearing loss, irritability, sometimes fluid drainage from the ear. Acute pharyngitis, sore throat, fever, swollen lymph nodes, and sometimes white patches on the tonsils. 6 physical examinations: AOM, otoscopic examinations revolves a bulging or red or opaque tympanic membrane. Acute pharyngitis throat examination shows redness, swelling, and possible exudate on the tonsils. 7 complications: AOM can lead to tympanic membrane rupture, hearing loss, mastoiditis, or chronic otitis media. Acute pharyngitis complications may include tonsillitis, sinusitis, rheumatic fever, or peritonsillar abscess in bacterial cases. 8 treatment: AOM, often treat with antibiotics if bacterial, pain relief with acetaminophen or ibuprofen. Acute pharyngitis, viral causes, care usually self-limiting. Bacterial causes may require antibiotics and symptomatic relief, including analgesics and throat lozenges. Non-duration. AOM typically lasts a few days to a week with or without treatment. Acute pharyngitis viral causes usually resolve within 5 to 7 days. Bacterial cases improve within a few days of starting antibiotics. 10. Prevention. AOM vaccinations, example pneumococcal and influenza vaccines. Avoiding second-handed smoke and breastfeeding can reduce risk. Acute pharyngitis, good hand hygiene. Avoid close contact with infected individuals and proper cough sneeze etiquette can reduce risk. 11. Seasonal variations. AOM more common in the fall and winter months. Acute pharyngitis, viral pharyngitis is common year around, while bacterial cases, example strep throat, are more frequent in late fall, winter and early spring. 12. Diagnostic test. AOM diagnosis is primarily clinical, sometimes supported by tympanometry or pneumotic otoscopy. Acute pharyngitis rapid antigen detection test (RADT) and throat culture can identify streptococcal infections. 13. Transmissions. AOM not directly transmissible, often follows a viral upper respiratory infection. Acute pharyngitis viral form are highly contagious through respiratory droplets. Bacterial forms can also spread through close contact. 14. Inflammatory response. AOM involves the middle ear's response to infection or blockage of the Estrichon tube. Acute pharyngitis involves the mucosal lining of the throat responding to pathogens. 15. Associated conditions. AOM often associated with upper respiratory infections, allergies and adenoid hypertrophy. Acute pharyngitis often associated with common cold, flu and other upper respiratory tract infections. Thank you. Have a nice day.